Hi, my name is Noreen and I work at the University of Exeter Medical School.
Hi all, I'm Richard Sharpe and I'm working in public health at Cornwall Council, and I'm also a honorary member at the University of Exeter Medical School.
Today Richard and I are going to discuss a recently completed research project that we both worked on older people and physical activity.
This project was funded by the National Institute of Health Research and aims to investigate what factors encourage older people to do more physical activity.
And also aims to understand which public health efforts work, such as interventions to promote walking for older adults. This research is particularly relevant today as we know that older people do not meet the recommended guidelines of 150 minutes per week necessary for health and well-being benefits.
In this project we conducted 2 systematic reviews, which is a method to systematically search all relevant literature and bring together that evidence in an unbiased way. We found that interventions promoted an extra 620 to over 2,000 more steps per day in older people, but the reviews failed to adequately report on equity issues. So, for example, we were unable to assess how people's lifestyles affected their physical activity levels, but we were able to look at how different activities such as walking and use of pedometers increased their levels of activity.
So I led on the qualitative evidence review, and this draws on research that has been gathered from talking to older people in interviews and group interviews. And from this research, we find that walking is an important type of physical activity for older people. It's important for getting around and staying active around their neighbourhoods and being sociable. And this is highlighted in the following quotation.
Walking then is a good thing because it's good for your own personal health. The thing is, you also see another aspect of life other than the envelope that you live in. I live in a small apartment here, and it's just good to get out of here and see the rest of the world. Also, you meet people and other people. You see how they live, and it's good to be sociable and meet other people.
While walking appears to help people do more, it was unclear from this evidence which delivery methods were effective. However, we can say that it appears that the use of text messaging and other remote delivery methods were effective. So these other remote delivery methods included the use of telephone or websites, for example. It was also unclear whether the type of person delivering the intervention was important in getting people to do more activity.
Well, Richard, it was interesting because in the qualitative review, text messaging or remote delivery didn't really feature, and rather it was the importance of the person. And the qualitative review did examine the role of health professionals in promoting physical activity, and some older adults reported that they did not receive clear guidance on exercise from the medical profession. And indeed, as the following quote shows, experiences with the medical profession could actually be demotivating for older adults.
I think sometimes the medical profession are too quick to look at your age and say, you've got to this age. There's a certain amount of luck in it, and him up there is playing a part. But I think sometimes they are too quick to jump in and say, oh well, it's deterioration. And that demotivates people to exercise, and I was demotivated then.
However, what also emerged from the qualitative research was the importance of the exercise instructor in motivating older adults to do physical activity. And they played a key role in creating a sociable atmosphere and a feeling of belonging to a group, which was really important for older adults.
See, that differs from the quantitative evidence, and here we could not identify which social interactions or larger lifestyle factors actually helped people to do more. I previously mentioned that reviews failed to report on these bigger lifestyle factors that may otherwise influence people's attitudes towards physical activity. So I think future work or future research really needs to focus on investigating and reporting on factors such as different places of residence, or people's employment status or their sexual orientation, for example, or even what drives people, what they like or dislike in terms of physical activity, and also how people perceive their own exercise identity. And these are some of the factors that are brought out in the following quotes.
I hated physical activity at school. I'm allergic to sports. I don't like it. Over the years, I have given it a try. I had tennis lessons at school, but I didn't really like them.
I think that exercise is just not part of who I am. I mean, I know that I should be exercising, and I know that it's good for me. I guess I just wasn't raised to think that exercise was something you needed to do. And other things in my life have always taken a higher priority. I think that affects me now, even though I know how important it is.
By understanding how physical activity develops over the life course, that is in youth, early and mid-adulthood, we can begin to understand physical activity in older age. So for example, in the qualitative research, we found stories from older adults recounting negative experiences of physical activity in childhood, which meant that they disliked certain activities throughout their lives. Similarly, positive physical activity experiences in youth can influence confidence in maintaining physical activity into older age. And enjoyment of physical activity is absolutely key for older adults, as highlighted in the following quote.
I love to feel the water as I glide through it. Cold at first and then pleasantly cooler as my body heats up from the exercise. There is a great sense of freedom and buoyancy when you can just float lazily in the deep end. I don't really like my face in the water all the time, but feel great when I do breathe correctly and feel the increase in speed and efficiency as I glide through the water. Then, of course, there is the pleasure of a hot, soapy shower and a nice soft towel to dry myself.